Welcome to On the Beat. I'm Linda Colson, your host for today, and we are here with Dr. William Gillespie and Dr. Ricky Johnston from Gastroenterology Associates of Columbus and Starkville, and we're going to be talking about GERD. What is that exactly?
GERD stands for Gastroesophageal reflux disease, but heartburn, acid reflux kind of in general terms.
So that's where that comes from. Is it the same as heartburn?
Yeah, it is. I like to tell my patients GERD is kind of a big umbrella diagnosis, and there's a lot of things that or a lot of symptoms that can present from GERD. Heartburn and acid reflux are what we consider typical symptoms, but there's a lot of other possibilities as well.
Well, what are some of those symptoms that you might experience?
So, as I mentioned, typical heartburn, indigestion is kind of what most people associate with it, but there's a lot of other atypical manifestations of acid reflux as well, and that could be anything from throat clearing or coughing, asthma, difficulty swallowing. People have pain in their chest that's not like a reflux or heartburn type pain, but just more pain. They can have discomfort in their stomach. People may experience bloating symptoms or pain in the right upper quadrant, left upper quadrant, nausea, vomiting. So there's a lot of different symptoms that can present from acid reflux.
And what might cause that? Why am I having this reflux?
Most reflux occurs because you've got valves in your esophagus that open up to allow food to go down and then close off to keep things from coming back up. But there's a little valve at the lower part of the esophagus. It's basically like a little ring of muscle that stays closed. In some people, that ring of muscle gets relaxed, and that allows some of the stomach contents to come back up into the esophagus, and that can be kind of irritating to people and cause some of these various symptoms.
What would be some of the ways that you would treat that? What can you do about it?
Well, the most common way to treat it are antacids from over the counter. Tums, Pepsid, things like that, they usually work okay. They'll treat it for a few hours if you just have occasional heartburn, but if it's something that you have all the time, especially at night, some of the medications we call PPIs, so like Nexium, Prilosec, things like that, they kind of keep the acid low all the time, and that can kind of help prevent any future problems from having too much acid exposure and chronic reflux.
And if you have that chronic reflux and you have it for an ongoing period of time, it can do damage, can't it?
Yeah, it sure can. We don't see it very much anymore, but there used to be a lot of problems with people who would get strictures or narrowing of the esophagus because all that inflammation can eventually lead to scarring, and that scarring can create really bad blockages of the esophagus that can make it difficult for people to eat. So we don't see that quite as much as we used to, but something we see with people who even have well-controlled GERD for long periods of time is a condition called Barrett's esophagus. And that's a more chronic damage from acid, where you get a kind of inflammation in the lower part of the esophagus, and it's actually a precancerous condition. So if it's something that's there, we like to keep an eye on it, make sure people's reflux is well controlled, and monitor that with time, because if it is Barrett's and looks like it's progressing, there's things that can be done to treat that specifically.
Right, and one of those medications that they use to inhibit this, what is the name of the medication? It's
PPIs, or proton pump inhibitors.
Yeah, proton pump inhibitor.
Yes.
Pump inhibitor. Is that a dangerous medication?
Well, it depends on who you ask. There's a lot of media publicity, and people get anxious about that because there's been some studies, albeit ones that were not really well done or very reliable type evidence, that have suggested that there are some potential risks associated with these medications, things that maybe affect your kidneys. The scary one people hear about is dementia, but some intestinal infections and thinning of the bones and magnesium and calcium absorption. So there's all these things that have been talked about, but they're actually very uncommon.
Well, it's so good to know, though, that you guys can help us manage this so that it never really gets to the point where you have damage or having to resort to medications that you might not be wanting to take. But we have enjoyed this so much. Thank you for joining us today. Be sure to visit their website as well. It's Gastroenterology Associates of Columbus and Starkville.